Welcome to Micromed Education. I'm Dr. Rachna Solanki, and today we'll discuss regarding infection control. The infection control, there will be series of lectures. So in the first lecture, we'll discuss regarding standard precautions. So what do you mean by standard precaution? These are the measures that should be followed when providing care to all the individuals, handling all blood or body fluids, and handling all the sharps or needle. Previously, they used to consider as universal precaution, but now the term is only standard precautions. So which are the standard precautions? These are hand hygiene, usage of personal protective equipment, safe handling and disposal of sharps, environmental control like spillage management, single-use equipment and appropriate reprocessing of the reusable equipments, practicing respiratory hygiene and cough etiquette, aseptic techniques, and appropriate handling of biomedical waste. First, we will discuss regarding biomedical waste. Basically, these are the wastes that are generated during laboratory diagnosis, treatment, and immunization of either human beings or animals or in any research activity that leads to production of this biological substance. These are the symbols of biohazard, and the C stands for cytotoxic hazardous symbol. What are the steps of biomedical waste management? Remember, the waste has to be segregated at the point of generation into color-coded bins that we will discuss in later. Then there should be pre-treatment of the laboratory waste and the liquid waste. After the segregation and pre-treatment, the waste has to be transported to the general waste site or the central storage area of the hospital. From that, the waste should be transported to the common biomedical waste treatment facility. In general, in our hospital we use E. coli system, and in the final is treatment and disposal of the waste that should be within 48 hours of the generation. So we'll discuss here regarding the biomedical waste segregation. Basically, they are categorized into various bins. The yellow is basically infectious non-plastic waste. Red is danger, and plastic is also danger. So red bin with infectious plastic waste. The blue and the white container is now considered as puncture-proof container and not the bags, because in blue there are glass ampoules, wires, and metallic body implants should be discarded. However, white puncture-proof container, needles, syringe with the fixed needles, scalpels, blade should be discarded, means all the sharp waste. Now in yellow bags, then it is a plain yellow bag or yellow bag with the C symbol. If the yellow bag with C symbol, in which waste that is used during chemotherapy has to be discarded, or contaminated or discarded medicine should be discarded. In yellow bag, remember all laboratory waste, blood bank related waste, vacutainers, and all infectious non-plastic waste like blood tinged cotton swab, organs, human tissues, this will be discarded. Tubes, etc. So how we categorize or do the final treatment of the different bags? So yellow bag generally goes to the incineration. Red and blue bags, these both bags should go into recycling after autoclaving or microwaving or hydroclaving. However, white bag also should go into the dry heat sterilization followed by shredding. Remember, PVC should never be incinerated as a generous fuel which is carcinogenic. Liquid waste subjected to the chemical treatment and then should be drained into the effluent treatment plant. And when a laboratory waste has to be pre-treated with the help of autoclave, the temperature and duration is same, like 121 degrees Celsius, 15 lbs pressure, but that has to be used for 60 minutes. Now we'll discuss in brief regarding hand hygiene. So in hand hygiene, there are three different types: hand rub, hand wash, and surgical hand wash. Hand rub, it is the agents used are alcohol based or chlorhexidine based. 70 to 80% ethyl alcohol is used, or 0.5 to 4% chlorhexidine. 20 to 30 seconds duration is there, and it can be used for during various patient care activities or during taking rounds. However, hand wash, there are certain indications like before or eating, before after eating, after using toilet, before after doing your duty, before performing any surgical procedures or any minor procedures, and when your hands are visibly soiled. The duration is 40 to 60 seconds, and soap and water can be used for the same. Surgical hand wash requires 4% chlorhexidine. The duration is 3 to 5 minutes, and it should be before any surgical procedure or in between the cases. Now there are WHO's 5 moments of hand hygiene. When one should do hand hygiene? Before touching any patients, before any clean or aseptic procedure, after performing a procedure or body fluid exposure, after touching the patient, and after touching patient's surrounding. Then the most important thing for hand hygiene is the steps. In your exam, there will be the students, you will be asked perform hand hygiene with either hand rub or just simply show the steps of the hand hygiene. So one has to remember, first, after taking 2 push of the hand rubs, palm to palm, back of the palm, interlace of the fingers, then knuckle, followed by thumb, then tip of the fingers, and if hand rub is used, allow it to evaporate, and if hand wash is used, wash with this water and use a single disposable towel, paper towel, not reusable. And for surgical hand wash, one has to use and clean the chlorhexidine based hand wash preparation and clean your hands up to the elbow and allow it to dry with a sterile towel. Thank you.